Hello, my name is Sarah Ferrante, and this is my Windshield survey presentation. I will be comparing and contrasting the two cities of Pismo Beach, California and Santa Maria, California. Boundaries are geographical for both communities. Physical assessment of Pismo Beach, beachside community, newer homes, mostly single-family dwellings, clean manicured neighborhoods, well-maintained streets, quiet and safe neighborhoods. Physical assessment of Santa Maria. Because Santa Maria is a very large community, I concentrated on the boundaries between east-west direction of Depot Street and Miller Street and north-south direction of Donovan Road and Betaravia Road. This is a farming community, older homes, mostly multifamily dwellings in this part of Santa Maria. Yards are unkept with clutter and trash. Streets have potholes and cracks and often no sidewalks. Vacant lots are abundant with loiterers. Safety is a concern even with police presence. There's a lot of street noise noted. People of Pismo Beach, population is approximately 8,200. Median income is $76,000 annually. Average home costs about $630,000, approximately 7.6 at or below poverty level. Caucasian 86.5%, Hispanic 6.9%, other 6.6%. I observed runners and hikers and bikers, and there is access to fine restaurants and health food stores in the area. Risk behaviors, I noted some bicyclists seen not wearing helmets nor stopping at stop signs or lights. People of Santa Maria, population is approximately 104,000. Median income is $50,000 annually. Average home costs about $300,000. Approximately 17.7 live at or below poverty level. Hispanic, 73.5%. Caucasian, 19.5%. Other, 7%. Numerous fast food chains in the area. Few people noted as exercising. Only one local health food store. Risk behaviors, drug and alcohol use and gang violence. In this photo here, 3 men were observed using needles and drinking from brown paper bags during my survey. While I do not have statistics on the prevalence of drug use and gang violence, it was a topic of discussion with my stakeholders and members of the community who both stated were significant issues in the area, Services Pismo Beach, neighborhood parks are ample, and I saw lots of children playing. Transportation is predominantly by private vehicle with limited public transit via bus. Adequate primary care doctors and specialists. However, many of the local doctors do not accept state-issued insurance. There are several walk-in urgent care clinics. 3 small hospitals service the area. There's no hospital in Pismo, but these hospitals are within 10 miles. The area is serviced by 3 elementary schools, 1 middle school, 1 high school, and 2 private schools. A community college and state university are within 15 miles of the town. Adequate facilities for groceries and personal shopping, including a large outlet mall. The area is predominantly Christian, followed by Catholic, and there are many churches to choose from. Santa Maria, there are several parks in the area, but all of them had litter and a lot of homeless loitering around. There is a YMCA and a Boys and Girls Club. There are 2 main homeless shelters. Transportation is primarily by private vehicle. Public bus is also widely utilized. The area is predominantly Catholic, followed by Christian, many churches to choose from. Police presence is adequate. The area is serviced by 10 elementary schools, 3 middle schools, and 4 high schools, plus 2 private schools. 1 community college in town. Closest universities are 30 or more miles away. And adequate shopping facilities, including a Costco and large mall. Economics Pismo Beach. Major employers include Diablo Canyon Power Plant, that's PG&E, located in Avila Beach. Employs approximately 1,500 from the county. Cal Poly University, located in San Luis Obispo, it employs approximately 3,000 from the county. And while PG&E and Cal Poly employ many in the area, the exact number of Pismo residents who work there is unknown. Other industries in the area include law enforcement, medicine, and agriculture. Economics in Santa Maria. Agriculture is the main industry in Santa Maria. Migrant workers are the predominant working population, some documented, others undocumented. Other major employers in the area include local farms, wineries, law enforcement, and Marion Regional Medical Center, where I work. Health issues. Talking with the community health professionals in both areas allow me to narrow down the health issues associated with each area. Pismo Beach is diabetes, heart disease, immunizations, and arthritis osteoporosis. Santa Maria is chronic kidney disease, diabetes, heart disease, substance abuse, alcohol use. Diabetes and heart disease are prevalent in both areas. According to Healthy People, the goal for diabetes is to reduce the disease burden of diabetes mellitus and improve the quality of life for all persons who have or are at risk for diabetes. For heart disease, the website states the goal is to improve cardiovascular health and quality of life through prevention, detection, and treatment of risk factors for heart attack and stroke, early identification and treatment of heart attacks and strokes, prevention of repeat cardiovascular events, and reduction in deaths from cardiovascular disease. According to the medical professional I spoke with in Pismo, refusal of immunizations is becoming an increasing concern in the area and should be addressed. Healthy People states the goal for immunizations is to increase immunization rates and reduce preventable infectious diseases. Recently, there have been several recorded cases of measles in SLO County, which is alarming for the community. Chronic kidney disease is prevalent in the Santa Maria area, according to one local nurse. Healthy People 2020's goal for CKD is to reduce new cases of chronic kidney disease and associated complications, disability, death, and economic costs. According to the PA I spoke with, osteoarthritis is a condition widely noted in the Pismo area. Healthy People 2020 has a goal to prevent illness and disability related to arthritis and other rheumatic conditions, osteoporosis, and chronic back conditions. Finally, substance and alcohol use is widely noted in Santa Maria. Healthy People notes the goal for substance alcohol use is to reduce substance abuse to protect the health, safety, and quality of life for all, especially children. To achieve these goals, education will be key, as well as swift medical intervention as necessary. In community resources, Pismo Beach, local churches offer meals and showers to the underserved population, and there's 2 local urgent care centers that offer services as an alternative to the ER. Santa Maria has the Salvation Army, which offers 1 meal a day and offers first come, first serve overnight shelter. Good Samaritan offers short-term shelter service based on urgent need, and it offers after-school program for sheltered children. This after-school program is where I'm going to be facilitating my teaching project. A few local walk-in clinics offer urgent care services as an alternative to the ER. And there's various local churches that offer meals, showers, and limited overnight shelter in some circumstances. Community strengths in Pismo, they're clean neighborhoods, exercise is a priority, neighborhood watch, and parent participation with student activities. In Santa Maria, it's police presence, church outreach programs, volunteers at local shelters, and the large Catholic hospital. Despite the challenges in the area, the Santa Maria stakeholders I spoke with remain optimistic about their community. Members of the community are dedicated to volunteering in various places to serve the homeless and those living in poverty. There are resources in the area for this population to utilize. Active members of the community are committed to making the town safe and inviting for visitors and prospective residents. I work at the local hospital in Santa Maria. It has about 200 beds, and it does not turn patients away for lack of insurance or ability to pay. The key stakeholders of Pismo Beach. I spoke with Jackie M., a physician's assistant. In addition to the health issues previously stated, Jackie's other concerns included drug alcohol use among adolescents, lack of medical access for the uninsured, and the increase in use of homeopathic remedies without the consultation of a healthcare provider. A local sheriff, Clint B., had concerns about the growing crime rate in the area, including burglaries and assaults, drug and alcohol use among teenagers, and a growing homeless population. The members of the community mentioned having the same concerns as the two stakeholders, including drug and alcohol use among teens, growing crime rates, and growing homeless population. Plus, they had concerns about the increase of housing prices and the lack of affordable rent and housing for those making less than the average income per year, and how that could be contributing to the homeless population. In Santa Maria, I spoke with Chelsea P., a community health nurse, and she had concerns about undocumented immigrants not seeking health care due to a fear of being reported or deported. She also fears small children are being left alone while parents work because they cannot afford childcare. And she mentioned an increasing mental health issues, especially among the homeless, and a lack of mental health resources in the area. The police officer I spoke with, Tiffany, also had concerns about mental health issues among the homeless. She fears this leads to much of the violence and drug use among the population. She's also concerned about the increase in gang violence in the area. Crime is high in Santa Maria, and there has been a stark increase in violent crimes over the past few years, according to Tiffany. The statements from the community echoed those of the stakeholders, with most concerns related to increasing crime and homeless rates and increasing housing prices. In conclusion, this experience opened my eyes in a lot of ways. I live in 5 cities, which is about 5 miles from Pismo Beach. I am comfortable in the setting and felt safe. I drove with my windows down for the ocean breeze and had no concerns about approaching people to ask questions. I have my own concerns about the area, but now have a deeper understanding of the community concerns. With 2 teenagers in the house attending local schools, I'm interested in further understanding the drug and alcohol use in the area. I work in Santa Maria, not far from the neighborhood I surveyed. I always feel uneasy driving in certain parts of Santa Maria. I drive with my doors locked and windows barely cracked. I do tend to avoid certain parts like the one I drove through. I did not feel comfortable approaching people on the street, so I interviewed friends who live nearby about their concerns. After this assignment, I have a much better understanding of the area and the community needs. It's even piqued my interest in volunteering in the area, especially with the youth. I also feel I am better able to serve the community as a nurse in the acute care setting. I especially would like to address the issue of immigrants not seeking out healthcare when necessary. Overall, this was an enlightening experience that has enhanced my perspectives and will assist me in my personal growth as a nurse. Here's my list of references. I hope you learned something valuable today about my community. Thank you very much.